Good morning again, everyone, and thank you for being here today. This is another office hours that we have. We've got some funding opportunities that are out now. It's for the non-congregate shelter and the supportive services through HOME-ARP. If y'all could just utilize the chat and put who you are and which organization you're from, that way we kind of know who is in the room. And has anyone started their application yet? Have any general questions about either of the funding sources for either HOME-ARP non-congregate shelter application or supportive services? Thank you, Tricia and Bo, for that introduction. Two of my fellow colleagues are here. I will let them come off camera and introduce themselves, or come off mute rather.
Hey there, y'all. It's Alona. I manage this crazy group of people. What did he always say? That fun and crazy times. Steve Martin. Wild and crazy times. Wild and crazy people. So anyway, but yeah. So HOME-ARP team, go HOME-ARP. Turn it over to Candace.
Good morning. I am Candace Spicer and a HOME-ARP specialist.
And y'all, I'm changing the meeting options so then that way you can go ahead and come off mute. If you even want, you can come off and non-camera and show us your beautiful faces or handsome faces. Or you don't have to do that at all either. So y'all can talk to us and let us know what's up. And if you want, and those of you, how many of you, can we get just a quick show of hands of how many of you were on the ESG call just less than an hour ago? Just a quick show of hands. Okay. We've got one. That's awesome. Okay, cool beans. Perfect. So we have a question. We have begun our application for prevention services. Great. Is there a maximum amount we can apply for regarding financial assistance? No, I mean, up to $250,000. And it doesn't have to be just for 1 year. It can be over the course of several years. So I think the biggest thing is just making sure that you have the capacity to handle that amount of money and how you plan on releasing it to folks. Again, it can't be organization specific. It has to be community-based services. So just know that. And yeah, so that's a good question. Does that answer your question, Tricia? And I think the thing is prevention services versus financial assistance. Just know that it seems to sound a little bit like ESG there. So just make sure that so your question, just making sure that you're we're similar but not the same. So just know the difference between the two applications. We got another one. I'm new to HOME-ARP. So, all the questions are good questions. For the non-congregate shelter grant, would those funds only be for constructing a shelter, or can they be used to operate an existing shelter? Jody, do you want to take this one on?
I'm sorry. What did you say again, Alona? I was distracted by an email.
That's okay. I am okay for non-congregate shelter. Who would those funds only be used for constructing a shelter, or can they be used for operating an existing shelter? And I'm asking Jody because I will talk a lot and I need to spread the wealth of all the love of sharing HOME-ARP information. So Jody, you want to take that one?
Yeah, absolutely. My pleasure. So the funding for non-congregate shelter is basically for the sticks and bricks of the actual structure. You can do new construction of a non-congregate shelter or acquisition rehab. Some of those examples would be like an older nursing home or a vacant nursing home or a motel that you wanted to convert to non-congregate shelter. But it would not be for the operations of that.
Yeah, and just know that HUD in their in the actual like notice of funding that they essentially had, their notice, their CPD notice, it states this will not be available for operational costs. They were very clear about that in the verbiage. So, but like some of the soft costs would also be available to be used as well. So if you have costs for like attorney fee, attorneys and even architects and those particular needs, it can help pay for those. But if you also want to use supportive services, it may not be able to help keep the lights on. But if you need to pay for a case manager for the shelter, you could apply for the additional supportive services funding to go along with the non-congregate shelter. Okay. Oh, we just had a question. Shauna, do you want to come off mute?
Good afternoon. I had just raised my hand because you asked who was on the other call and I forgot to take it back down. But I
Okay.
do have a question concerning
Yeah.
because I was on the ESG call, and as I'm looking at like this little PowerPoint, like where it starts, where did home art come from? I'm really liking the fact that it's a little bit more like you have some leeway with a couple of things. And I guess my question would be like, is it on the DCA website to apply? In what sections? Is it like the ESG where you have certain sections you have to apply for, like street outreach and, rental assistance and things like that? How does that work?
Parts of it will be really similar. Um, we have several webinars on the YouTube page that you can review for like
Hmm.
specific trainings that we have on the application.
Right.
But a quick answer to your question is you can apply for multiple streams at once. So you don't have to do separate applications like ESG. It is available through emphasis is where you can apply. And so we are using a different system, but it's a pretty simple one. And we're just
Hmm.
asking you mainly to complete an Excel spreadsheet, which has a lot of different tabs, and upload that along with some other basic information. And all of that is really in that Excel workbook. And so that's a big thing to complete. And that includes the budget and locations of where you want to offer it, those particular areas. Um, the funding, unless it's population specific, like just for people who are homeless, you would need to
Hmm.
offer it community based. So it can't be just for people in your organization, and it can't duplicate services. So you cannot have the funding basically uh, if you're already, so for example, if you have a case management program and you want to use the funding to kind of take over your current funding with all the same people who have been receiving case management, you can't do that.
Hmm.
It
Okay.
can't take over for something. It has to be either new people who have not ever received the service before, so
Okay.
brand new service for that person. They can't ever have received that service from another program, or you just start a new program. And so you're going to get new clientele and they're going to have new options in the area and that kind of thing too. Um, so those are two things to consider. So it can't take over something you already have going on. And it can't be just for the people in your organization. Unless you are using it in a non-congregate shelter setting, then yes, it can just be people in your non-congregate shelter.
That's great. So, because that's the goal, because I'm a social worker in my organization, Boys to Men Development. I have most of my clients are court ordered, and I work with families that have a lot of barriers, and I've always wanted to get there. Like, and as an organization, we help out people that come to us that may need clothes, food, you know, I give them free case management. Hey, this is what you need to do to get things in order within your home. A lot of them work hard, but they also fall short with things and need assistance. So I feel like, this will be, because I'm naming the program Divine Intervention. So I feel like this part of the DSA would be great for my organization with wanting to do something new. So I just now I've got to get my mindset to where it switched to this. And could you give me the deadline and where I can go to look up, because I had been researching the ESG. Could you give me the where oh Lord, where I need to go for this as far
Yeah.
as learning more about the documents needed and all that?
Yeah, so I will show it to you. Jody put our HOME-ARP website on in the chat. So if y'all go to our main DCA website, if you search HOME-ARP,
Hmm.
okay, it'll bring up. There we go. So usually we come up as the first. If you come down to the bottom, this is the public notices. You'll see all of our notices that are out. So if you want supportive services, here's where all the documentation is. So here's the actual NOFO, here's the Excel workbook, and then here's the supportive services breakdown. So this is everything that we can we can fund.
Okay.
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 Then
Okay.
and we've not really had any questions come up. And then we have webinars. Also, here's the emphasis site in order to submit your, to submit everything. Now, as far as dates go, the final date to submit is April 25th. However, for those of you who are not in, okay, we need to quiet one of the groups here.
Yes, I did. I don't have a vehicle. That's why I was calling you guys, because you guys are closer to me anyways. So,
okay, there we go. Sorry about that, guys. So what we're going to do is, for those of you who are a non-participating jurisdiction, so in the balance of state. So, and actually, Jody, I know you put the list of PJs. So if we could put that into, here it is, actually.
Got it?
Yeah, I got it. We're doing a rolling review of areas that are not on this list. So if y'all are in an area that is not on this list, we're going to start reviewing your application now. Okay. So, and if you get above a certain threshold of 70% or more, essentially, or like 70 points kind of thing, then we will award you. So just letting you know, we've not received any submitted applications yet, guys. So if you want to be a part of the pre-awarding section, or pre-select section, I probably should say, not necessarily award. We need to make sure everything else is met. But a pre-select, if you want to be a part of that, you better apply now. But you cannot be a part of these jurisdictions. If you are, then you're going to have to wait until we'll do the review of, you can submit, but we'll wait for your review until after the 25th. Okay. But if you're in another area, just letting y'all know, it's time to submit. So that's that. So Shauna, did I answer all of your questions?
Yes, so one more. So what you're saying is it is due April 25th, but you're saying because from what I understood was just the last part you were saying is go ahead and apply,
Yeah.
and see in the jurisdictions, or when we get ready to go in to apply, it'll be listed out there.
Yeah. What area are you in, Shauna? What city are you in? Muskogee?
Columbus, Muskogee County. Yes,
Okay.
ma'am.
So Columbus Muskogee already received HOME-ARP funding. So what we'll do is go ahead and you can wait until the 25th. You can submit now until the 25th. What we'll do is we're going to be reviewing Muskogee along with the other participating jurisdictions and the rest of the applicants who submitted by the 25th. And we're going to go ahead and score y'all at the same time. And
Okay.
then essentially ranking everyone after the 25th. But beforehand, because we're trying to reach areas that did not receive HOME-ARP funds yet,
Right.
we're
Right.
doing a rolling review of those groups. So then that way, if they submit now and they score at a certain range, then we'll go ahead and select them right off the bat.
Okay.
So we could, yeah, okay.
Okay. Thank you.
You're welcome. The next was Megan. Megan, is it Giles? Giles? Go ahead and go off mute. I think it's Giles. Giles? Giles?
Hey, can you hear me?
Yeah.
You are correct. It is Giles. Most people pronounce it wrong. They'll say Giles, Gillis, everything else but Giles. So you got it right. I want to say that you answered my question because of what I was going to ask about was the eligibility, and I think you pulled it up, and I tried to search it while you were doing it, but now I can't find it. You said that there was a list of what you could use the budget for. And I want to make sure because what I have an organization called Live Like Mike Homes, and what we provide is affordable shared housing for individuals and then sober living for individuals. And what my goal is to use some of the funds to either fix up homes that we already have and or provide rental assistance. So say if someone comes to me and say, hey, I'm in between jobs. Do you have a room for me? I can say, you know what, I can cover the first 2 months. And then after that, you pick up the tab based off the funding. So I just want to make sure that something like what I'm doing is eligible.
So for the rental assistance, I mean, I'd have to go into the specifics of it. And it's right here. It's the third one down is the breakdown of what you can do. What I would say though is you would probably need to show that you could have a lease. So there has to be a lease. I don't know if housing them like in your agency location, I don't know if that would be one is, I don't know if you can go ahead and do a separate room, like multiple rooms in a house. I don't know if that is going to be an option. You may want to actually look into the RPH program, which is the rental partnership housing, I think is what it stands for. It has to do with people who are, it's coming out of corrections, so it's not quite the same population, but similar-ish. That may be an opportunity where they do help fund like rooms. This wouldn't be kind of like you would have to set them up in an apartment.
Gotcha. So the funding has to be for like apartments or anything like that.
Yep, that's correct. We could help with food, and doing those types of things. So that could be an option. Reentry partnership. Thank you. It's not rental partnership, reentry partnership. I appreciate that.
Yes, I heard of them. And Thor, I think.
And Thor.
Okay.
So that, but that's different. That's in a different department. So that's
right.
So I think that there may be some of these options that could help support your program, but then it also can't be just for your participants. It needs to be community based. So it needs to be anyone in the community who needs assistance. So
we could offer scholarships to other like organizations or whatever, whoever they're trying to support.
So
things of that nature.
Right. So if you want to help them get employment or education, that's totally a part of the list.
Perfect.
Yep.
And then construction, you guys said construction would be on there. Say if we're rehabbing a spot, but it is because how we do it is that it's shared housing, so we wouldn't be able to use it for rehab for that or construction for that.
No, because our non-congregate shelter construction is for a locked door and a bathroom for each unit for each household.
Gotcha.
So so
it could be studios but it can't be like, okay, I'm following. All right, thank you so much. This was very, very helpful. I appreciate it.
Good, yay. Next we got Kate. Hey, Kate. It's been a long time.
Hey, Alona. So I think you've answered my question in the last couple of minutes, but I'm gonna throw it out there anyways. But it's about the qualifying populations and the eligible clients that we can serve. So if our agency or the program that we're applying for has a specific focus, like youth,
Right.
From what you're saying, does that mean that if a senior citizen with no children calls us and requests help, that we would have to provide that?
Yeah.
Okay. All right. That was my main question.
Yeah. So it's, yeah, which makes it, I know, difficult in some circumstances. The only way to serve the people in your organization with that supportive service is if you also get non-congregate shelter and or rental housing funding for your organization. And then we can do just the service just for your organization. So yeah. Yeah. So they did not allow us to limit or preference the populations that are served outside of kind of what the service requires. So for some of the things on the list, it's really just for people who are homeless. So like if you're helping pay for someone's rent because they are unhoused, then that would be for a homeless person. So it's the basic logical, so it's not going to be for someone who already has an apartment, So so that's the difference. So that's correct. Yeah.
Okay, thank you.
Alona, did you want to talk a little bit about the it being a grant reimbursement, so that it would be a cost reimbursement where they would I'll let you extrapolate on that, but I just wanted to put that out there.
You got started. I think it's a great
Yeah.
point. Go ahead and mention it. Talk about that.
So and I know we got a couple of more people wanting to ask questions. I'll just put this out there. So this is a cost reimbursement grant. So you would have to have the money up front to fund these services. And once you submitted your invoices, receipts, and your draw request form, and as long as everything was complete, then we could issue that reimbursement. Just wanted to, didn't want to be a Debbie Downer or anything, but just wanted everybody to be aware of that, this is the way grants work with DCA, and just wanted to put that out there.
It's an important thing to note. Okay. No. Okay. So, Sister Deborah, you are next on the hands raised. So please, what's your question?
Oh, praise the Lord, everybody. Everything has been just so wonderful, just sitting back here listening. I think most of them already got answered. Before I forget what Jody just said about the reimbursement, let me throw that back out real quick. So if I'm spending $700,000, I have to show you where $700,000 is coming from. I have to spend it and send the receipt later. How does that work? Jody.
So are you talking about for a non-congregate shelter?
Non-congregate shelter. What's the difference in the shelters? Non-congregation. You tell me, is that everybody living in the same house? Is that congregation? Or everybody, individuals living in separate houses, rooms? What's the
Jody, do you want to answer this one?
Good morning again, Sister Deborah. So a non-congregate shelter, as long it's just that it's not a big open room where there are a lot of different beds or cots. It's where each individual or family gets their own space, their own bathroom, and their own sleeping quarters with a lockable door. There can be a communal kitchen, but just they all have to have their own private safe space to go. So I know the other day you had mentioned a quadplex. That's absolutely that would work as a non-congregate shelter as long as there were no strangers sharing a sleeping space and a bathroom.
Understood. Got you.
Yes, ma'am.
Thank you. All
My
right.
pleasure. Yes, ma'am.
Piggyback again on the reimbursement. How does that work? Do I go out and spend $700,000 and send you a receipt, or do I write it into my grant and I show you where it's coming from?
So I'll go ahead and answer that one for you. So how the process will work is, if let's take supportive services as an example, okay?
Okay.
So the maximum amount of grant funding for supportive services is $250,000. Okay. And so what would happen is, if your organization is selected, we're going to go ahead and put together a contract, and it's going to specify everything that you can spend money on. And so that's going to be essentially everything that you've requested. So it would be, food or rental assistance or whatever the case may be.
Mhm.
Then what you would do is you would then submit to us. So let's say after that contract is signed by both parties, then you can start spending money. And we would tell you what you would need to have as documentation stating that that we need for the file to show, yes, I spent this money and this is what happened and we're all good. So
whose money am I spending? Am I spending my money? Am I showing documentation so you can release the money that I'm spending?
So where I was going to go with that is, we would give you training on what invoices and things that we would need in order to show documentation that it was spent.
Okay.
Then what you would do is you would spend the money. Okay. We're going to ask for the information a lot sooner. So let's just say you helped someone move into an apartment.
Mhm.
And it was $1,000 for rent plus utility deposits. Well, actually, let's make it $2,000 because that's probably a little bit more realistic. For utility deposits, first and last month's rent, all the package was $1,000 or $2,000. You would submit that to us with the backup information that you spent that $2,000, and then we would reimburse you that $2,000. We would not recommend that you kind of do it in one fell swoop and ask for all of the funding at the end of spending all of the funding. We would recommend you do it as you go along.
As I go. Okay.
Yeah.
Okay. Next question. There is a house for sale right next door to our current building. Can we purchase that house for single living?
So the non-congregate shelter funding can be used for acquisition, but again, that would be to have every unit for each household with a door that locks and a bathroom.
Okay.
So probably a hotel, motel, older nursing home, hospital would probably be a better acquisition than a home.
Well, if I can construct it.
If you could, yeah, absolutely. If you can make sure that it has a lockable door and a bathroom for every unit, that would be an absolute option. Yeah. But it would have to be, it would have to be it would be a shelter. And the other thing too that I want to make sure that you understand is, looking at protected classes, it needs to be able to accommodate families. It needs to be able to accommodate individuals with disabilities. And then also, it cannot be gender specific. So you would have to serve, basically you need to be able to serve everyone who is unhoused.
Okay. Let me see, I had another question. The current property that we're in, can we build tiny homes in the back of our current building?
Yeah, tiny homes are definitely, they are an option. So I think for all development, even the rehabs and things, there is a $5 million cap for one. So just be aware of that for HOME-ARP. Is it 5 million or is it's not 4, it's 5 million. Yeah. I'm trying to think through. Yeah. And so just know that tiny homes tend to be, I understand the reason behind them, but they also tend to be basically the more roof lines there are, a more expensive procedure as far as building goes. Just in general. But it's not a no. I mean, we have several that have come up in Savannah and Brunswick and all over the place that are great, great developments. So, I mean, it really would depend on the project that you have going on. So,
Right. I spoke with our bank counselor on yesterday about the quadplex, and she said getting in the zone where we're at and permits might be a little bit harder behind our building. We have something going on, and you all may know about the ADUs, additional dwelling units, and it has to be in the back of an existing ownership property. So if I can't go with listening to her, I may not be able to do that quadplex. She suggested looking into tiny homes. Instead of the quadplex, we may be able to do 4 tiny homes back there, or 3 to just meet your qualification. So that's why I asked. So thank you. I think that'll wrap it up. I yield my time back to you.
thanks.
Looks like we have someone else with their hand raised. If you want to come off mute so you can ask your question, please feel free to do so.
Good afternoon.
Good afternoon.
My name is Iffy. I'm the executive director of the nonprofit Children's First. We're a child placement agency, and so we serve kids in foster care. We've been doing it about 10 years. And we do want to, I guess, expand. And I have a few questions for you. My first question is, I guess I'll start with reimbursement. I guess after providing supporting documents, whether it's supporting documents for, I guess, acquisition or supportive services, how long does it take to receive the reimbursement?
That's a really good question. The plan is to have it probably within 30 days. The first reimbursement may be a little bit longer just to make sure we have all the vendor requirements in place. But we have a different kind of system than other department. I shouldn't say system, I guess process. No, not process. It's coming out of a different area of DCA, so we anticipate the turnaround, something we want to focus on to be quick, because we all know that y'all don't have a ton of money to keep spending. So the plan to turn around the financial piece is probably within 30 days.
Okay. And then my next question is, I guess when it comes to congregate shelter, the type of program I was interested in doing, it's a new program, but it's still, it's the same thing we're already doing. So we want to serve youth with special needs, I guess a home for kids with special needs. But I wanted to know if it could be open. So from what you told me, it has to be open to the community.
You're talking about the non-congregate shelter?
Yes.
Yeah, you need to be able to serve all 4 qualifying populations. And I'm just going to put a very brief synopsis of what those 4 qualifying populations are in the chat.
Okay.
And then
If you're
go ahead, Alana.
So basically, if you're wanting to serve a group that is special needs focused, that is a population that, as far as limitations, and preferences, you can't, well, the limitations and preferences for non-congregate shelter are a little bit more difficult. We are going to request in general limitations and preferences for the 4 QPs, as well as veterans, which is kind of specific to the HOME-ARP program. And we're going to ask that of HUD, but getting more specific with individuals with disabilities and those particular groups, I don't know if, because of the requirements HUD has had with limiting and preferences, I don't know if this is the best funding for that. Because what we would have to do is go back to HUD and ask for additional preferences and limitations for that particular population. It's not unheard of. Most of the groups that have had preferences and limitations have been mainly around like domestic violence, obviously chronic homelessness, those particular groups, because we can't, the protected classes is like a thing. So for example, if it's a youth, development, you have to be able to house youth with families. If it's, an elderly development, you have to be able to house elderly people with families and young kids. And so with even people with disabilities, obviously, non-discrimination of people with disabilities would be a piece. So a specific disability in that group, I think, would be a little bit more difficult. We would probably have to put in a question to HOME-ARP at HUD.gov to make sure, but a specific disability, I don't know if that's going to be a possibility. And then you'd have to be able to accommodate people with disabilities who have families as well. Does that make sense?
Ify, can I ask what area are you wanting to put this? It sounds like a group home for persons who are differently abled. What area are you in the state?
I've been looking at a few areas, either Houston County or Newton County.
Ify, I will have your I would like to reach out to you. Nothing to do with HOME-ARP, but my husband and I actually used to be a host home here in Georgia for persons who are differently abled. And I would like to maybe connect you with a service provider that could help you start that.
Yes, please. Can I have to get off the call because I have another meeting. But
Absolutely, yes.
can I send you my number and email address?
I just put my email address in the chat, so please feel free to reach out to me and I can help you as I can in that endeavor.
That's great.
Okay.
My
Thank
pleasure.
you.
My pleasure.
Thanks, Ify.
All right.
Tammy. That was a good answer, Jody, by the way.
Thank you. My pleasure.
Tammy.
Yes, hi, good afternoon. I don't know, maybe I misheard, but I was just trying to find out, this funding, does it also cover veteran housing or transitional housing?
It can cover veteran housing. We're working on putting together limitations and preferences that include veterans and getting that approved by HUD. So that is a potential. Transitional housing, okay, so the rental housing NOFO that recently closed, that is for a unit that has a lease on it. And the non-congregate shelter developments for HOME-ARP are units that have no lease or occupancy agreement. It has to be kind of more of a generalized occupancy agreement. It doesn't quite fit into the transitional housing piece, simply because transitional housing tends to be a little bit longer than a shelter housing. However, there is no length of time that HUD required for the non-congregate shelter development. So it could be in a bit of a gray area. So the answer is sorta. So it would depend on how you structure the housing. So it can't be strictly transitional. HUD doesn't do transitional housing, but it would have to be we would have to really see your project development structure and your plan in order to help make sure that individuals were transitioning in and out of the non-congregate shelter in the best way possible to show how the process would be working for your particular development. I feel like I'm not talking clearly with regards to that, but that's somewhat intentional and somewhat not intentional. So, Jody, do you have any other thoughts on that? Because I know you're deep into
No,
non-congregate
you're
shelter.
exactly right. I'm glad you brought up the piece about there not being a lease. Because you also cannot charge, and this may go without saying, but I have to put it out there. You can't charge someone for staying in the non-congregate shelter. There are no fees attached to it. But like Alona said, it's extremely low barrier. While we're in this Q&A, and low barrier is indicative to housing first. So you serve people where they're at when they come to you for the non-congregate shelter. And yeah, you can't, no leases. But there is a gray area because there's not a limit of time that they can stay there. I see Cammie has her hand up. Go ahead, Cammie.
Okay, am I off mute? Can you hear me?
We can hear you.
Okay,
Yeah.
all right. So my name is Cammie Downey. I'm the board chair for Family Promise of White and Habersham counties. So we're up in Cleveland, Georgia. And so I've been listening to all of this, and I'm very new to this. This is my first experience with you guys. So if I ask anything, just bear with me. I don't know where we fall in. The way our program works is we have 3 houses. One of the houses, the families, we house only families. There's 3 bedrooms, so and we'll house 3 families. They each get a bedroom. It has a door, with a lock and everything, but they share 2 bathrooms in the kitchen in the living area. In the other house, one of the other houses is transitional, so I'm okay there. And then the second house is actually a duplex, and we can house single men and single women. But it's the same type thing. They have their own. No, they share bedrooms in that one. We have two per bedroom, and then they share the kitchen and everything. So where do I fit in?
I don't know if this funding is appropriate for you, Cammie, sadly.
Okay, that's what I'm wondering.
So breaking it down, again, every household needs to have a lockable door and a bathroom. Right. Now, there can be developments where, kind of similar almost to a hotel, where, you have that door in between two
right.
rooms.
Yeah, you're talking about my dream.
Yeah, so you're able to expand and contract a non-congregate shelter as needed. So that would be, that's kind of, excuse me, the consideration, the makeup, of the development that you would have to consider. Obviously, roommates aren't an option. That would be considered congregate housing, even if it's not a large room with multiple bunk beds.
Right.
You're still congregate. It's not by household. So I don't know if this would be the best option for you.
Right. That's kind of what I was thinking. But I was wondering, do y'all fund programs? Like we have 2 different programs that we help everybody in the community if somebody comes to us for rent assistance or utility bills or anything like that? Do y'all do any funding for those type of programs?
That's what I was going to recommend. Is
Oh, okay.
we do have our supportive services grant that's open, and we do have utility bills as well as helping to pay for short-term and long-term rent, for that matter. Almost like a sort of a TBRA type program, a tenant-based rental assistance program, that y'all can utilize. Essentially, what you would need to do is, take a look at it, but you would have to be able to serve everyone in your community. So it can't just be for Family Promise, you know, participants. It would have to
Right.
be for community based, but it sounds like you're already doing that with
Yeah,
utility assistance.
we are.
So yeah, so I would definitely check that out. If you guys have people come to you for utility assistance, this would be an option to be able to use as a funding stream for that. But you just can't
Oh,
repeat it. So if someone has already received like utility assistance from you in the past, um, then it would have to be a new person to receive that utility assistance. You can't
okay.
duplicate. They can't have already received it from you previously.
Okay, gotcha.
I don't know what Jody or Candace, I know Candace has been really deep into the supportive services right now. Is there like a length of time in between services that they could have received like a statute of limitations kind of thing, like a time limit?
Not that
Or
I've
is it
seen.
just, yeah, I haven't seen that either. Okay.
No.
Yeah,
Just making
generally
sure I'm
our
not missing
policy
anything.
is 6 months, to a
Right.
year. That's just our policy.
Yeah.
But we partner with a couple of the churches in the area. Sometimes, they can pay half the rent and we can pay the other half, and if it's too much. So is that something that's allowed?
Sorry, I got distracted really quick. Cami, could you say that one
Mhm.
more time?
Yes, it's that we sometimes partner with churches in the area,
Yeah.
and like somebody, if they have a bill that we can't completely fund, we'll split it with the church.
Oh, that's totally possible. Yeah, yeah, yeah.
Okay.
So
Okay.
it's really just the non-duplication piece. So if they've already received like utility assistance, you cannot then have HOME-ARP do utility assistance for them again. What you may
Okay.
want to look at is then if they've never received rental assistance before, that that other church could cover the utility assistance, and then HOME-ARP could cover maybe the rental assistance for
Okay.
them. So that would be the steps to
Okay.
take.
All right.
Okay.
So, and I can find the supportive services on your website, and I see somebody put a link in there.
Yep.
Like I said, there's a link in
Okay.
the chat as well.
Okay.
Yes.
Okay. Thank you. Thank you so much. This has been
Oh,
great.
absolutely. Oh, good. I'm
Yep.
so glad.
Yeah, appreciate it.
And Shauna asked about emphasis, and so what I'm going to do is do a really quick, and I can't go through all of it because when I pull up my emphasis, it ends up being like all the emphasis that we can see. So I need to be careful as far as what we can show. But if you go to emphasis registration here, you would just need to fill out this basic information, okay, to register. And then when you complete that, then you would go ahead and complete this, and then hold on a sec, let me do it over here. Give me a second, folks.
I just want to say while you're doing that, Shauna, it's super easy. I did it just to do a little bit of troubleshooting last week, and it was easy to register, and then the whole application popped up. So yeah, super easy.
Yeah. So once you register and then you log on, completing your information, this is going to pop up. I too did a test. As you can see, it says Elena test here in the corner. So you would fill out the application, and then you would either fill out the non-congregate shelter version or the supportive services version. And then you would go ahead and put your name in, and then it may pop up as a no. Oh, it worked. Okay. So here is the supportive services. And as you can see, there's not a lot to complete. We have the contact information that you have to complete, who you are, the team, your grantee team. So everyone that's, a part of it, which includes a federal compliance administrator. And if you don't have someone here, just go ahead and put NA. So it's not applicable, because some of you are rather small, so you may not have your own attorney. That's absolutely fine. Just put not applicable. And then some general financial information, the total HOME-ARP request, and then the total budget in case, there's additional pieces of, like, for example, rental assistance. If you have I'm going to use a very big number, a $500,000 budget for rental assistance, and you just want HOME-ARP to help fund like $100,000 of it, that kind of thing. The general section of comments and clarifications, it's actually, I had to do this really quickly, so I couldn't delete some things, but any additional comments you want to make. Here's the upload of all the documents that you have to do. The starred ones are the ones you have to have. But it's good to produce as many of these as possible and uploading those. This is just the compliance agreements around a participating coordinated entry, HMIS, equal access, things like that. And then the final certification that you agree to all of these things. So it's a super easy application. You would have to do is actually I need to stop sharing my screen. So stop that. So when you go into HOME-ARP, looking at the supportive services, and here is the section on the workbook. So this is what you would download and open up. Okay, let's do this one more time. Not popping up. Shoot. Oh, and you guys can't see it. Probably a good thing. Hold on a sec. There we go. So then this is the Excel spreadsheet, and it has everything from all of the budgets to complete, application overview, attachment checklist, your general information, kind of everything that you guys have going on, your project design. This has a lot more information, but a lot of this is also very similar to what ESG has. So just go ahead and complete these things, as best as you possibly can. Your overall supportive services plans. So what you plan to do, how many people you plan to serve for each service. And here are drop downs, or should be drop downs. Oh, enable editing. So you'll be able to select your drop down and where it's going to be located, and then how many people you plan to serve. It's very similar for your budget. You could copy and paste the list of those groups and locations where you're serving, and then how much you're asking for each of the 4 years that it's available. Matching calculations, referrals to supportive services, referrals to households, application sites, board members, and then your program staffing. So that's the bulk of what you would have to apply for.
I just want to add, this is a really fantastic opportunity to really help those most vulnerable populations in Georgia. This funding does sunset in 2030, and we are doing all that we can on the compliance end to make sure y'all are ready to go. We have created numerous forms to just ensure the compliance piece is taken care of, and I would highly encourage anyone who may be interested to apply for this. Go ahead, Vanessa.
Oh, sorry.
Oh, I'm sorry, Shauna.
I just
Um,
wanted to say that as you're talking, I'm also reading through the 20-page information, the that kind of, and I noticed, so you said, so is it due the 18th or the 25th? I have until the 25th to apply.
Non-congregate shelters due on the 18th.
Hmm.
The supportive services is due on the 25th. But
25th.
if
So I'm reading the wrong thing because I'm reading about, because I even looked up, okay, so I need to go to supportive services. Okay. Thank you.
yeah. Vanessa, go ahead.
Hi, good afternoon. Thank you so much for a lot of information. This is wonderful. I have a question about eligibility. We are located in DeKalb County, and serve survivors of domestic violence and human trafficking, and we do offer rent assistance, and like utility support. So just wanted to see if we are eligible, given that we are in DeKalb County, although we serve survivors across the state of Georgia.
So yeah, you can apply, and hopefully I'm not, and you're referencing the supportive services, correct?
Yes, yes.
Okay. So Candace, do I need to let you take this, Candace, or go ahead, Candace? I'm sorry. I get too excited.
Well,
So you're fine. I'm sorry. But yeah, I'll probably rather let you guys do it. Y'all know this so well, and I'm kind of new to this, so I don't want to miss anything.
so okay, I'm wanting to give everyone an option to talk. So first of all, it's a really great question. So as far as the supportive services, we cannot do preferences and limitations if it's not attached to a building. So if you have a non-congregate shelter that was funded by HOME-ARP, and then you add supportive services to that, we could help the individuals who have domestic violence specific issues to be served. Okay. However, for the supportive services, it cannot be specified as far as a particular population. I know that creates some difficulty when it comes to domestic violence, but that was kind of guidance that we had from our TA from HUD, when we did have our TA from HUD. And so when we asked about limiting supportive services for situations like populations like what you've said, they said no, has to be available to the community, which I know proposes issues for a DV population. So this may not be the best funding for you if you don't want to pair it with a non-congregate shelter.
I understand. Thank you so much.
Yeah, sorry about that.
No problem.
It stinks, I know. Well, we're at 12:30. And guys, just go ahead. Let me also, we're going to put in the chat before we close everything down, the website for all of our upcoming webinars. Right now, it's kind of a little bit, it has today's as the last one. We just scheduled some for next week. So if you want to hang out with us again, we're doing it next week as well, especially before all of the yeah, thanks for putting that up there, Jerome, too. We also have, they're not posted yet, but next week we're going to post some for Tuesday, Wednesday, and Thursday for HOME-ARP webinars. So then that way y'all can ask us any questions right before the non-congregate shelter application is due. So we'll have that available. So, and thanks, Kate. It was good to see you. So, yeah, so if you guys have any other questions, that's it for us for today. We'll see you next week. And like I said, we'll be uploading that to our website by about tomorrow. Okay, so check out that website for the webinars coming up, and we'll also send out our listserv too. Yes, Sister Deborah. Okay. I think it may have been an accident. So, okay, guys, thanks so much. Have a great afternoon, and we'll talk to you next week.